Hi everybody! My name is Hannah and I just wanted to welcome you to our podcast. If you're joining us today, we will be talking about the history of nursing and the development of early nursing education. We have many speakers with us today and they'll be introducing themselves to you throughout the podcast. So stay tuned and enjoy.
My name's Patricia and I'm going to be talking about the establishment of the first nurse training schools. Before the establishment of nurse training schools, there were no available formal education for nursing. The earliest nurses learned and practiced from oral traditions that were passed down from generation to generation, from observations of how others care for the sick, and even from practicing trial and error. During the Crimean War in 1854, Nightingale traveled to Crimea to care for the sick and wounded. She believed that dirt were the cause of diseases and organized to clean the soldiers' barracks and hospital wards. The number of deaths decreased dramatically within months, and she documented these results to use as a basis for further interventions. This set the foundation for modern evidence-based practice. When Nightingale returned to England, she was recognized by the British people and was given a trust fund. Through this Nightingale Fund, she established the Nightingale School of Nursing at St. Thomas' Hospital in London for the education of professional nurses. Nightingale, along with the instructors, planned the students' experiences and emphasized proper education of the nurse rather than what the hospital needs. In 1861, the Civil War began in the United States. At the time, there were no nursing schools, no trained nurses, and no nursing credentials. The title nurse did not have any specific requirements and could refer to anyone from an officer's wife who came to accompany her husband, a woman who came to care for a wounded son or husband and others, a member of a Catholic religious community in a hospital, or a volunteer. These volunteer nurses went to war without any formal training or education of nursing and only had the basic knowledge of nursing care from their personal experiences caring for their loved ones. In 1872, the first school of nursing in the United States was established in the Women's Hospital of Philadelphia. Following the Nightingale model, the school had a curriculum set, paid instructors, equipment to practice nursing skills, a nurse's library, and a provision to other hospitals for student experiences.
My name is Jennifer Jimenez and I'll be talking about the Bellevue School of Nursing. The Bellevue School of Nursing played an essential part in the development of nursing schools. It was the first training school for nurses in the United States. It opened in 1873 and was attached to the Bellevue Hospital. It was the first school in the United States that ran according to the Florence Nightingale's nursing principles. The staff consisted of trained nurses supervised by women who oversaw nursing services in the Bellevue Hospital. Planning of the school started when a woman named Louisa Lee Squire led a group of women in which they wrote a report to the State Board of Charities that the conditions of the public hospitals of the city and county of New York was unacceptable. They proposed that adding trained nurses would improve care, so they formed a committee to look into the creation of training school for nurses. The committee then convinced the Board of Charities, and the first trial consisted of 6 students in 5 wards. When the trial was a success, the committee extended nursing work to the rest of the hospital. The training involved basic cleanliness, neatness, and patient comfort. In the late 1870s, the doctors that worked in the Bellevue Hospital began to give a lecture on anatomy, physiology, and hygiene. By 1879, 63 students were enrolled in the school, and in 1878, the school had its first building for classrooms and student rooms. At first, the school did not have a specific uniform, but by 1880, the uniform was blue and white striped fabric. Bellevue Hospital was also part of the Bellevue School for Midwives, which was the first official school for midwives in the United States. However, the school only remained open until 1936. The hospital was also part of the Mills Training School for Men, which opened in 1888. The school was to train male nurses to work in men wards of hospitals. In 1929, the Mills and the Bellevue School of Nursing merged under a single administration, calling the Bellevue School of Nursing. The school was also part of World War I, where a lot of graduates left to serve the armed forces, which caused a shortage of nursing staff. In 1940, the school introduced the different stages, which were freshman, junior, and senior levels. In 1947, Bellevue shifted to a 40-hour, 5 days a week work, and during World War II, they signed on for a cadet nursing program, which they enrolled about 600 cadet nurses. In 1950, there was a change in school for nursing. They added a 12-week psychiatric nursing module to comply with the new requirements issued by the New York State Education Department. In 1954, the Bellevue Hospital opened its own communicable disease units, which furthered student experience. Students now were offered an opportunity to study in peds and home care. And in 1957, middle students could now study OB. In 1963, the curriculum was shortened from 3 years to 2 years and 9 months. In 1967, Bellevue Hospital transferred its facilities to Hunter College, where they received their bachelor's degrees within the 4 years. And the last class that graduated for Bellevue Hospital was 1969.
Hello, my name's Hannah, as I introduced myself in the beginning. So now that we've been introduced to some of the first training schools developed in nursing, let's talk about the conditions in early nursing education. Approximately 10 years after the first training schools were developed, the amount of schools founded had grown to 35 schools. It was common for schools to be economically dependent on the hospitals in which they were located in. Therefore, due to the hospital's needs at this time, it was common for hospitals to take advantage of their students and use them for free labor. For the hospitals, it was an obvious decision to use these students due to the many economic benefits. For example, it was cheaper and overall more cost-effective to have these students work on-site rather than to train and pay new graduate students. This was considered their students' clinical training. Where unlike today, clinical is supervised and more hands-on with their instructors and preceptors, where their training had little to no supervision. Shifts were about 12 hours long, and some students were required to stay overnight within the hospital next to their patients. The actual classes for nursing students were very irregular. Since most students were being used at the hospital, classes were often canceled in order to keep the hospital wards staffed. By the 1900s, the number of schools founded grew even more, from 35 to 432. Many schools were founded within specialty hospitals. These were hospitals that were smaller than regular hospitals and would specialize in certain areas. This would be such as a mental hospital or a tuberculosis sanatoria. Because so many of these schools were founded in these more specialized hospitals, students were not getting the proper training that they needed. Students were only trained in hospitals with no more than 25 beds. After nursing students graduated from their training, it was really rare that they were hired at a hospital. Due to the economic benefits of using nursing students, graduates would seek employment through private duty nurses. This is when nurses would be caring for their patients within the patient's own home. These kinds of patients would pay out of their own pocket to receive their private care. During this time, many private duty nurses were utilized because for those who could afford it, it was really normal to have their babies born and delivered, as well as have surgical procedures in their illnesses treated within their own home. So to wrap up, we talked about the conditions of early nursing education. For nursing students at this time, they had more harsh conditions. However, the more schools that opened up gave more opportunity for women to be more financially independent.
Since the 1960s, complicated procedures, new pharmaceuticals, and biomedical advances have evolved. This, along with an influx of new patients with the introduction of Medicare and Medicaid, has increased the demand for more educated and skilled nurses. This is why more nurses are now required to be practicing with a Bachelor's of Science in Nursing instead of an associate's degree. In the 1970s, community college nursing programs proliferated due to an increased emphasis on equal opportunity. Additionally, graduate nursing education programs became popular, giving nurses outlets to become proficient in various specialties. In the 1980s and the 1990s, more nurses were needed with an ever-increasing demand for highly skilled nurses. As a result, many nurses went back to school to include roles such as a nurse practitioner, clinical nurse specialist, and certified nurse midwife. From the early 2000s to today, nurses are becoming more educated and skilled than ever before. Now that we are in the digital age, information is accessible at the tips of our fingers. Currently, nursing schools offer many different opportunities for specialization and further education, including oncology, critical care, neuroscience, obstetrics, pediatrics, public health, and administration. Although the styles of nursing have evolved throughout the years, the themes of holistic and compassionate-driven care have remained constant within the nursing profession. Nursing, to this day, continues to be a well-respected and revered profession. Well, folks, you've reached the end of our podcast. You have listened to the history and development of early nursing education. Thanks for tuning in.